It's a topic that most people don't like to talk about, but we all have to talk about it sooner or later. How to take care of yourself or a loved one when nearing the end of life. Dr. Elizabeth Golding is here to help make those conversations a little easier. She's the medical director of Cone Health Palliative Medicine Services and a member of the Cone Health Medical Group. Good morning.
Good morning. Thank you, Brad.
It's a tough conversation. We've been talking about it throughout the week, giving people kind of tools and suggestions and things like that. Let's talk about when. When should you be having this conversation about what would you like toward the end of life?
Thanks, Brad. So this is always a tough conversation to have for anyone. Really, anyone over the age of 18 should at least consider having an advance directive. The reason for that is life is unpredictable. We don't always know what the next day will hold. And so the key here is really to be prepared so that if an accident happens, if you start to get ill, that you've talked to someone about your wishes so that if you're unable to speak for yourself, someone has an idea about what it is that you would want in those situations.
And it's important to talk about it and to make sure that your loved ones know, but you also, I guess, need to solidify that with something on paper, a document that they can go to a hospital and say that this is what they told us, and this shows that.
Yeah, and what I tell people is it's this think, plan, and do. And so the thinking part is thinking about what matters most to you. What is quality of life to you if you were to get sick? And then the planning is who are those people that you trust? A close family member, a spouse, a child, those kinds of things. In the do part is where you really need to you go from the conversation into actually implementation of a directive so that it's actionable and so that it's accessible, and so when you need it the most, your healthcare providers or whatever setting you're in can act on that and make sure. That's the advance directive part. There are many misconceptions about what an advance directive is, what a healthcare power of attorney is, and so what we really want to stress is that it doesn't require an attorney. This is not an expensive thing to do. It's a necessary life health thing that we need to do. And so you can bring it up with your doctor. You can also, we have great resources at Cone Health where you can go even online and complete your advance directives, and also has tools to help you think about those things. So the do part is really putting into action a document that will stand up if you're unable to speak for yourself.
One of the things that we talked about earlier in the week was the fact that for a family member, when it is one of the worst times in your life and trying to figure out how you're going to progress from here, having that in place and knowing that your wishes can be followed, it's almost a relief during a very tough time, but it frees them up a bit and it makes them feel better. If you can do anything for your family members, it's having that in place right away.
Being prepared is the single most important thing that you can do, because I see families all the time that are in crisis and they've never had the conversation, and that leaves a lasting burden on your family. So it's a gift. Give that gift to your family to say it's okay to talk about this, and people spend a lot of time not wanting to talk about it, but once they actually talk about it, most people report a sense of relief, a sense of being able to rest assured that their care will be what they want when that time comes.
Well, as you said, you've got folks at Cone. There are a lot of different medical professionals that can help you through the process and make sure you're getting the right things done at the right time.
Right.
We appreciate you talking about this week.
Thank you, Brad.
It's a good conversation to have.
Great.
And you can find out more. They make it easy by putting some of that online. So if you want to go find out more, learn more, go to conehealth.com/advance directive. And again, that's a great resource. You can go there and find out more about that conversation you should have with your family. Or for more healthy lifestyle tools or resources or classes, check out conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.